Hello everyone, welcome to this session. If you need to do research, you need to understand two keywords. One is the login name. Yes, that is good clinical practice. And the other, guess what? Yes, it's password. And you're right, that is ethics. So this is a session on ethics in research and I'm Dr. Danya. So in this session, we'll be seeing about the brief evolution of the ethical guidelines as well as informed consent. Almost all major advancements in ethics have arisen from the ashes of a war or healthcare or research scandal. So, do you recognize this? Yes, yes, it is the Nuremberg trial. 23 Nazi doctors were subjected to Nuremberg trial for doing heinous experiments on humans using poisonous gases, ice, and whatnot. And thus emerged the Nuremberg Code in 1947, which emphasizes voluntary consent. In the 1960s, an astute physician McBride found that women who were having morning sickness who consumed thalidomide were delivering babies with absent limbs or phocomelia. Several instances of case reports were published worldwide, and thus the Declaration of Helsinki was put forward in 1964. Since then, it has undergone so many revisions. And do you know this? This is the infamous Tuskegee syphilis study. More than 400 blacks in America, they were subjected to study the natural cause of syphilis. Even after the discovery of penicillin, they were denied treatment so that doctors could study the natural cause of syphilis. Is that just? No, of course not. And thus evolved the Belmont Principle in 1974. What is ethics? Thomas Percival said that ethics is the moral principles that govern a person's behavior or conduct of an activity. When science clamors for advancement, ethics keeps everything in check. Ethics tries to see whether the research is done in the right way. So India is not far behind the scandals. Our own Kerala in the 2000 was represented for doing misbehavior in ethics in the RCC. After that, they have been pointing out of several instances like the human papilloma virus vaccine disaster in Telangana or the Moradabad oxygen incident and so many. So as I've already mentioned, the Nuremberg Code developed in the 1947, Helsinki Declaration in 1964 followed by reports of phocomelia, and the Tuskegee syphilis study led to the development of Belmont Report. Yes, our first policy statement was in 1980s and the ICMR has revised it several times, 4 times, and the latest revision is in the 2017. And the Indian TCP guidelines came out in 2001 and it was revised in 2018. And the Schedule Y came forward in 2005 and it was revised or replaced actually by the new drug and clinical trial rules in 2019. So these are the ethical principles in research. Integrity and competence of the researcher. Responsibility and honesty of the researcher. Justice to the participant. Dignity to the participant. Privacy and confidentiality. And what are the major principles or major pillars in research? They are autonomy, beneficence, non-maleficence, and justice. So what is autonomy? So those who have read the Immortals of Meluha, they can understand this excerpt. Lord Shiva and his clan on entering Meluha were given Somras. Somras is equivalent to our Amrit, okay? Now, he says that even before administering Somras or Amrit, we should take opinion from our participant. Even if it is going to give us immortality, even if it is going to give the patient immortality, you have to obtain consent from your participant. So autonomy is acknowledging people's right to make choice for themselves based on their own values and beliefs. So in this excerpt, it is said that you should have that told us the complete truth at Mount Kailash. Then you should make an informed choice rather than you making a choice for us. So that is the relevance of informed consent. അമൃത ആണെങ്കിലും ചോദിച്ചിട്ടേ കൊടുക്കാവൂ. So here the participant does not know that he is participating in a study. Yes, your guess is right. We are going to learn about this, and this is the first instance of informed consent recorded by astute physician Walter Reed, who did experiments in yellow fever. What is informed consent? Actually, informed consent is a process by which the subject voluntarily confirms his or her willingness to participate in a study after getting all the information. Yes, it has to be taken by a medically qualified person. It has to be documented in the medical notes and consented prior to the participation and approved by the ethics committee. There should be no coercion for participation, and the consent form has to be in a non-technical language, preferably in the mother tongue of the participant so that he understands it fully. What if the person is illiterate? If the person is illiterate, or if the person is not in a position to give the consent form, like if there's a medical emergency, or if it is having any psychiatric illness, the legally acceptable representative can give the consent. If the participant is illiterate, there should always be an impartial witness signing the consent as well. So the original patient information sheet and the consent form has to be filed in the site file, and it has to be kept separately from the data. And the copies of the patient information leaflet as well as the consent form has to be given to the patient. So in the informed consent, we should be touching upon the purpose of the study, the methodology, the time duration, the risk as well as the benefit, the alternative treatment, confidentiality, compensation, withdrawal from the study, the contact person, as well as the voluntariness in participation. So from 1947, we have been emphasizing on voluntary consent. Now, these are the vulnerable population: children, prisoners, pregnant women and fetus, cognitively impaired participant, socially, economically, and politically disadvantaged, differently abled, terminally ill, ethnic minority, sexual minority, abandoned or orphan, as well as the institutionalized persons. They are all the vulnerable population. And let us see into the informed consent document. Informed consent document consists of the participant information sheet as well as the informed consent form. There should be passage of the information, and there should be comprehension by the participant, and he should voluntarily give his willingness. So there should be a discussion between the physician and the participant. There should be a review of the information, and all the queries and concerns of the participant need to be addressed. We should give ample time for thinking whether the participant should really participate in this research, and finally the signatures should be obtained. So if the patient is literate, then he can directly sign the informed consent form. And if the participant is illiterate, then we can obtain the left thumb impression, but we need to have a legally acceptable representative signing the document in presence of a literate impartial witness. Similarly, if the patient is medically incompetent, especially in the case of some vulnerable population, then again we need a legally acceptable representative, and we can take a re-consent on recovery of the participant. So the informed consent form must be signed as well as dated by the investigator. Now, withdrawal. Sorry, dear, you can't withdraw now. You sign a consent form. There is nothing like that. The participant can withdraw at any point in the study, even without giving a suitable explanation. Now, the ICMR has categorized the risk of the study into less than minimal risk, minor increase over minimal risk, that is less risk, and more than minimal risk, that is high risk. So based on this, we can take the consent. Waiver of consent can be taken if it directly benefits the patient, involves no more than minimal risk in retrospective studies, public health studies, and emergency or life-threatening situations. Audiovisual recording is a must in case of new chemical entity as well as in the vulnerable group. And audio recording is required in the case of HIV patients as well as syphilitic patients. What about children? Now, children, we assume that the cognitive development is not enough for understanding, but these days of online learning, we know how much they are advanced in cognitive learning. But in case of research, if the child is age 0 to 7, we have to obtain parental or LAR consent. If the child is above 7 years, then the assent comes into play. 8 to 12 years, we have to obtain a verbal assent as well as consent from the parent. And 13 to 18 years, we have to obtain a written assent from the child. Now, what is the second major principle? That is beneficence. Beneficence, bene means to do good and ficere means to act or do good. It is the action in patient's best interest. Can be an action of charity, kindness, love, and altruism. So, do you recognize this statement? Yes, this is a snapshot from the film Ulladakam. Here, Jagadish Sriuma is a psychiatric patient and he says that he has consumed a horse. And what does the doctor do? Doctor voices that he is asking for enema. Operation Venda, enema madi. But what does the doctor tell? Yes, we have to do an operation so that we can take that horse out of your abdomen. Now, beneficence means acting in patient's best interest or the researcher's best interest. For example, if a patient is having a diabetic foot and we are saying that we will just the patient is denying operation, then will we stand for that? No. We will tell him, make him understand that if you continue with this, and we need to do this below knee amputation so that we can save your life. Now, what is non-maleficence? Non-maleficence is doing no harm. Every time we think that we are going to do the best for the patient, it might not be the true. Like in the last instance, even though the doctor did the surgery, did it completely cure the patient because he was having a mental illness. He was telling, "Adu karatha kudirayalla, njan vizhngiyathu velutha kudirayanu, ayyo." So we should not think that all our action is going to benefit the patient. Our first aim is to do no harm to the patient. And this from the film Apothecary. You can recall that Vijay Nambiar uses his poor patients to test drugs on behest of a giant pharmaceutical company, and that led to death of so many participants. And this is another instance where Prithviraj in the film Ayalam Nyanamil, he is he has wronged the patient because of her father, because of a previous grudge with her father. So we should not do harm. നല്ലത് ചെയ്തില്ലേലും ചീത്തയൊന്നും ചെയ്യരുത്. And what is justice? Justice means equitable distribution of all the benefits. And this is not the thing that has to be appreciated. We live in such an unjust world. There should be non-exploitation of the participants, and every benefit should be pointed out a priori even before the participation. And they have to be compensated for participation for research related injury and have to be given ancillary care as well. So, virtue, justice, equality, fairness, and integrity are important for a researcher. And what happens when secondary interest, be it financial or non-financial, comes in? Then comes the conflict of interest. So, before participating in a research, we have to declare the conflict of interest before the ethics committee. There can be general ethical issues. The ICMR proposes several student projects, but the students can never be a principal investigator. He has to be a student researcher, and the guide becomes the principal investigator. Similarly, if it is an investigator-initiated research, the compensation has to be decided by the ethics committee. And communication of research has to be done. Community engagement has to be taken care of, especially if we are doing any research in underprivileged communities. And the post-research access as well as benefit sharing has to be communicated to the participant a priori. And in public health research, we have to get two levels of consent, verbal as well as broad, and routinely collected data under program condition in public research, and there can be even waiver of consent. What about human genetics testing? This can cause social stigma and discrimination in the school and employment. So we have to be very careful. It can even cause psychological problems, anxiety and depression. We have to thoroughly discuss the risk and benefit, maintain the confidentiality, and take care of the stored sample as well as publication of result. The confidentiality of the participant has to be maintained. And finally, fabrication, falsification, and plagiarism of the research findings should not be promoted. So, this is a point to think upon. Does informed consent really exist? Thank you.